For our final session of the second day of the Future of the American Child journalism training, we're going to focus on another very important aspect of providing support for communities, and that is healthcare and healthcare access. In an area like McAllen, in a region like the Rio Grande Valley, providing access to immigrant children and families is a complex, ultimately rewarding, but can be a challenging pursuit. And so we're going to be talking to an organization that I think you've all heard of and is legendary in its founder, the Children's Defense Fund. Marion Wright Edelman was a role model for me growing up. And so anytime I get an opportunity to work with CDF in whatever state I'm in, I pursue it. So one of the first calls I made when I started this project was to the Children's Defense Fund Texas office. And so today we're joined by two staffers with CDF Texas. Michelle Castillo is the Deputy Director for CDF Texas, and Cindy G is Communications Director for CDF Texas. So they're going to be talking about their work in doing outreach in communities and in providing enrollment for healthcare for children and families. So thank you both for joining us today, and please take it away.
Thanks, Rachel. We are so appreciative to have the opportunity to be over the Zoom with y'all. I'm, as Rachel mentioned, Michelle Castillo, and I am originally born and raised in the Rio Grande Valley, and I wish I could have been there, but couldn't. And I now reside in Austin. I have a background in the Texas legislature and electoral campaigns here in Texas. And with CDF Texas now as the deputy director, I help drive some of the strategic movement building across our issues. And so I'm excited to talk to y'all a little bit more about the work that we do together with my colleague, Cindy, and I'll let Cindy introduce herself.
Hi, everyone. My name is Cindy. I am the communications director, and I've also helped to support a lot of the digital organizing efforts across our grassroots strategies to help and support families and activate and mobilize them. So some of the things that I'm really excited to talk about are ways that we can partner better with media in getting the right messages out to families. So with that, I think we will get into a presentation, and I'm going to share my screen.
Yes. So we'll be talking about how our outreach and enrollment teams, CDF Texas has offices all across this, has offices across the state and relationships across the state. We have an office here in Austin, and then one in the Rio Grande Valley, as well as in East Texas and Tyler, Texas, and in Houston. And we also have partners that we'll be talking about towards the end of the presentation that are in the Panhandle and in El Paso. So we very, very much cover the entirety of the state. And I know, Cindy, you were going to talk a little bit more about our Texas work.
Yes. Rachel has already very beautifully introduced the Children's Defense Fund. We are a national organization with offices across different states, and this is our mission. In Texas in particular, we lead a lot of the immigration work and advocacy that the entire organization's supports. And one of our other unique focuses is that we are both doing advocacy work and organizing work, but also supporting families on the ground with the direct resources that they need. So here is our outreach team in the Valley. We really wish that they could be here tonight to be talking to you all about their experiences and what they're seeing on the ground. But of course, their work requires them to often be out in the community, working directly with families. And our teams really go to the places where families are, schools, businesses, community centers, going everywhere with the information they need to enroll in programs like Medicaid, CHIP, SNAP, healthcare.gov, and a lot more. And we will share a lot of what they've been seeing on the ground over the course of this presentation. So what we're really hoping to do is highlight the three big issues that we see really affecting the health of immigrants and immigrant families here in Texas, but also all across the nation. In particular, we want to highlight these issues because we think the media and reporting can play a really huge role in connecting families to the information that they need. So those three topics broadly are getting coverage, so getting healthcare, and getting access to programs like Medicaid and CHIP. For this topic, we are talking specifically about the public charge rule and how it's created a huge amount of fear and confusion for families and deterred them from even trying to seek out any form of help. Our second issue is staying covered. So once families have coverage, issues and barriers they face in maintaining and renewing that health insurance. And one of the big issues that we're expecting is that we're seeing in Texas and everywhere is that state agencies have to redetermine millions of applications this spring and throughout the rest of the year as a specific Medicaid provision is being detached from pandemic era rules. And we'll get into that in a bit more detail. And then the last is covering the whole family. So making sure that families can get access to healthcare as well, and not so that it is easier for them to cover their children and take better care of their children. On that point, we're going to talk a bit more about Medicaid expansion specifically in Texas and across the South, but also talk about grassroots strategies that are needed to move these issues forward. And with that, I'm so sorry. I just realized I was on the wrong slide. But with that, I am going to hand it over to Michelle to kick us off with our first topic.
Yeah, so we know that y'all have had a very long day, or long 2.5-day trip now, I guess. And so we wanted to make, and we're at the end of today. So we wanted to make the information sharing that we were going to be, engaging. We're trying to make the information sharing more engaging, I should say. So we have a myth fact quiz. Now I know y'all are there in person. So I think what we'll just do is have y'all raise your hands if you think it's a myth, and raise your hand if you think it's a fact. So the question is, sorry, go ahead, Cindy.
Oh, okay. So the prompt is, my U.S. citizen children receive SNAP. This affects my ability to become a legal permanent resident. Raise your hand if you think this is a myth. A lot of hands. Raise your hand if you think this is a fact. Okay, just a couple of hands.
Okay.
It is, in fact, a myth. There is a public charge test that applies to immigrants who are seeking a visa for the first time or a green card for the first time. There's a lot of confusion around what benefits it applies to, but one thing is for certain, and it only applies to a very small number of benefit programs that the person seeking residency accesses. So if children, if anyone else, other family members are accessing programs like SNAP or Medicaid, it will not affect their immigration status. We're going to move on to the next one. My U.S. citizen children receive Section 8 housing assistance. This affects my ability to become a legal permanent resident. Raise your hand if you think this is a myth. Okay, raise your hand if you think it is a fact. Okay. I didn't get to see the hands in the room. Michelle, did you catch where people?
Yeah, and I think there was more myth than fact from what I
Okay. It is myth.
Yeah, so you got it correct, y'all.
Yeah, so one of the big reasons why we use this one is because under the Trump administration in 2017, that administration issued a modified public charge rule that included Section 8, and that rule was just rolled back earlier in 2021 after the Biden administration came in. And actually, as of December 23rd of 2023, which was just over a month ago, a new public charge rule was finalized by the Biden administration that created a lot of protections for families and also provided a lot more clarity around exactly what the public charge test is, who it applies to, and what benefits are included. This continues to be a huge issue because of course, in our communities, they don't necessarily know that these changes have happened or understand these changes. And they often need to hear from a community organization or someone from the ground, like our own staff, to trust that information and change their behavior. So I'm going to pass it now to Michelle to talk a little bit more about how huge of an impact public charge has had on our communities.
Yes, can you go to the next? Yeah. Yes, exactly what Cindy was saying is that we actually did that myth and fact exercise in some of our community education trainings in the Valley. And a lot of families thought that it was fact. You know, they answered fact for the questions. And we tested them before. We did the quiz before the training, and then we did the quiz after the training. And we got to see how the training very much helped assuage a lot of fears that their children could access benefits, that they could access benefits, and really help clarify some of the confusion from the previous administration's anti-immigrant rhetoric. And so what's important to know is that the anti-immigrant rhetoric, along with the confusion with the immigrant families, had very much affected the enrollment rates for CHIP and Medicaid. What we witnessed was and if you go to the next slide, Cindy, between 2017 and 2020, we saw over 240,000 children that were disenrolled from Medicaid by their parents. Now, it's hard to say with 100% certainty that this was all due to the public charge. But our organization put out a report on the public charge where we had conversations with a lot of families on the ground. And it was definitely something that we heard time and again. And that could not be understated how much of a chilling effect the fear and the anti-immigrant rhetoric had on the decisions to disenroll their children from Medicaid. You know, this is healthcare coverage for their children. So we've been, as Cindy mentioned earlier, working together with statewide and nationwide organizations to lead the effort in on the ground community education trainings to ensure that communities know that the Biden administration has actually changed the rules, and that means that accessing benefits is completely safe for their children. And it's not only safe, it's what we want them to do. We know that healthier children lead to better educational outcomes, better lifelong outcomes. And so that's what we've been doing together with partners. And I'm happy to share, I think the next slide is part of that's right. So Cindy's going to share a little bit about a specific story, but we're working together with the Seguro Texas campaign to do a lot of these on the ground trainings with folks. And what's really wonderful about this model is that as we connect with families on the ground, specifically about the public charge, because of our outreach and enrollment teams, just experience in enrolling, and that's the work that they do in signing up children and families for Medicaid and now SNAP as well. Any family that's eligible within those trainings, we're able to get them connected to get healthcare coverage, or to help connect them to any other partner or resource, whether it be in housing or whether it be with the food bank or any other needs that the family might have. So it functions not just in educating the community, but also helping them connect to other resources that they might need for their children.
To put in a bit more concrete terms, what the fear and confusion has looked like for people. This is a story from Rosario, who is actually an advocate that works with Arise Adelante, which is one of the organizations we partnered with in the Valley to do our community presentations. Over a decade ago, when she was getting her green card, she showed up to her appointment. She saw her file. She saw her documents in her file. She'd been working up to that moment for a long time, and it meant a lot to her. But then when she got there, the immigration official asked her if she was receiving any government help. And she was honest and forthright and said, yes, my children receive Medicaid and SNAP. And the official told her, well, you need to cancel those benefits in order to get your green card. And so she went home, she spoke to the agency, she asked to remove her children from Medicaid and SNAP, which were providing really crucial healthcare services and food for her family. And the agency had actually given her the correct information. They said, these are only benefits for your children. They should not affect your green card application because you do not directly benefit from them. But because she was uncertain and because she was confused and because this was too critical a moment for her, she decided to disenroll her children. And then for a long time afterwards, she was really scared to get help and reach out and try to apply for other public programs that would have really benefited her family because of this incident. And now when she talks about it and now that she understands, she said that she would have acted differently had she known her rights. And one of the things that we really think about from this story is the fact that so many official sources are giving people in our communities the wrong information. So immigration officials, immigration attorneys as well. We are working with our partners to try and educate as many folks as we can. But this is why it's one of those areas where having media provide the right facts to families will also help to dispel these myths and help to dispel a lot of the confusion and fear that they have been experiencing for decades. And to that end, I wanted to take a moment to talk a little bit about some of the coverage that we've gotten on public charge and what has worked particularly well and what has worked a little bit less well. So first things first is that, of course, immigrant families are, even if they're not necessarily reading every article about public charge, they are getting that information and they are hearing it, but often selectively. They might hear a version of it that plays on their local TV channels, or they might see a headline from a social media post that a friend or other family member shows them on their phone. So they're getting information, and when the anti-immigrant rhetoric is there, and when the fear is there, that directly impacts and affects them. So when we are reaching out and trying to get coverage on this issue, the first thing that we prioritize are the key messages that families need to know. So it is safe to get benefits. It is safe to enroll other family members in benefits, and these will not affect your own immigration status or your chances of being deported. Having that family-facing takeaway is huge, and we try to uplift it wherever we can. Another thing that one thing that I really appreciated is when I recently worked with Telemundo Digital. The reporter directly asked me about concerns she knew families would have, which is specifically there's been a lot of changes to public charge rule in the past couple of years. What's to say what's to say that the next administration isn't just going to change this again and families have to worry about it all over again? And I was able to provide some more specific legal details about why the new Biden rule will be more difficult to overturn. And then the final thing I'll add is that in Texas in particular, but also broadly, a lot of this coverage can be very wonky. It can be very legal. As some of you may know, our Attorney General, Ken Paxton, is leading a lawsuit with 14 other states to challenge the newest public charge rule. And that in itself can be scary and for families to hear. It throws the certainty of the public charge rule into question for them. And so that's why we try to encourage reporters to provide some context about what the lawsuit actually means. We know that it's going to take a long time. We know that in the meantime, the public charge rule, the Biden public charge rule is in effect, and that it is safe to access programs like Medicaid and SNAP and Section 8. And also we try to emphasize that even if the lawsuit succeeded, that doesn't mean that we're going to revert automatically back to the Trump rule. There's a huge process, and we encourage families to focus on the fact that they can get the help that they need. I'm going to pass it back to Michelle for our second topic.
Yes, another quiz.
Okay, we can skip the chat question.
Okay. All right. So how many folks in the room? Well, I don't know how we're going to do this one. How many people?
We can do hands for each item.
Yeah. How many people does Texas Medicaid need to redetermine? Let's just see a raise of hands if you think it's 500,000, 1 million. Raise of hands for 1 million. Okay, raise of hands for, okay, there's a few. What about 2 million? Okay. That's a few. And then 3 million, anyone for 3 million?
Feels like an auction.
Yeah. Let's see what the correct answer is, Cindy. It's 3 million.
It's actually, so specifically, it is 2.7 million. I think if we had time to go over the previous question, so essentially, as many of you may know, at the start of the pandemic, there was a federal rule that went into effect that prohibited states from disenrolling people from Medicaid, even if they were no longer eligible. And the goal of that was to make sure people had access to healthcare throughout the pandemic. But that rule is now officially ending on March 31st, 2023. And it means that state agencies now have to go through the process of figuring out who in their Medicaid programs are still eligible and who are no longer eligible. This seems like it shouldn't be an issue, but there are many, many reasons that this could be a crisis in Texas and also all across the nation. And just to be a little bit more specific, the groups of people who we're expecting this to really affect are children who turn 19 between 2020 and now and have effectively aged out of Medicaid. There are also a lot of pregnant Texans and Americans who were pregnant at some point in the past few years, but no longer are pregnant, which means in states like Texas that have no Medicaid expansion, it just means they're no longer eligible. And finally, there are families with children who maybe their income went up a little bit and they're no longer eligible. But this is actually a huge concern for families who are still eligible for Medicaid, because we're expecting to see a lot of challenges and barriers to getting these families effectively renewed. And we're expecting a lot of people who should still have Medicaid to lose their access to health coverage. And that could mean missed doctor's visits, children not being able to continue the therapies that they need, and more. I'm going to pass it back to Michelle to say more.
Yeah, and the scope, the size of the problem cannot be understated. 3 million or 2.97 million children is in the backdrop of a severely underfunded state agency that is already has been experiencing a backlog. So in October, we know that from our folks on the ground that have been helping families, that the agency was processing applications for May. And this was October. And these were families who are eligible for benefits, eligible for health care, but are having to wait to hear from the agency because they're so short-staffed and because they're so backlogged. So that combined with the delinking of Medicaid because of the public health emergency unwinding, it makes for a very big crisis of healthcare access. And the fact that it is happening as we are coming off of a pandemic and y'all are hearing the stories on the ground of the importance of access to mental health. And in the Rio Grande Valley, it was already prior to the pandemic, just to use that where you are as an example, that was already facing a shortage of mental health providers. I think the stat that I remember seeing was one psychiatrist per 2,000 patients, like just case ratios that are not sustainable, where you just know that children were not getting the attention and the care that they needed. And this was prior to the pandemic. And so we are trying to get the word out to families so that they know, because a lot of them have not had to apply for renewal during the public health emergency, so they might not remember the process how to do it, and it's a very onerous process as well that I'll go into in a little bit. Many families may have moved. And so we're partnering with school districts. We're reaching out to child care centers just to get the word out, to make sure that families know that they have to renew, that the deadline is March 31st, and then after that, the agency can start taking children off the rolls, so to speak. So Cindy, can you the next slide, please?
Can I ask a question?
Question?
Yes.
Hi, I'm Maria Garnolado with W9J Hola. I appreciate this piece. I plan to write this story. I'm in Illinois, and so when you say understaffed, you mean like the people who would help folks enroll, like who help folks?
Yes, and I want to clarify that this is for the Texas Health and Human Services Commission.
Gotcha.
But there are a lot of open positions, so it is understaffed and underpaid.
Okay, so is that how? And I was gonna ask how that's measured. So it's like they have the openings. Is it like anecdotal? Like they're telling you, the agency's telling you that they're understaffed. Like are they like they're telling you their concerns about this deadline?
Yes, so our outreach and enrollment teams work directly with a lot of, so the agency has regional offices as well, where they serve their different regional populations. And so our outreach and enrollment teams partner with those. And so there's anecdotal evidence anecdotal stories from the regional centers, but then also the postings of jobs, the high turnover rate, the inability to retain staff in the agency. All of these are things that are they're like jobs are posted online that they're constantly having to fill these roles. So there's anecdotal and like job posting data.
And these are
to turn to.
Thank you for that. And these are state agencies. they have these offices. So it's like, because like in Illinois, like they have the like the county has their public health where people would sign up, and in addition to like nonprofits, you know. But you're saying state agency have their office where folks would go to sign up. Okay.
Yes, and they'll often coordinate with the public, like the county or the city public health coordinator or office. So they're all sort of talking to each other. But when it comes to at least Texas CHIP and Medicaid, that is done through the state agency. And so counties can refer, like if a child is, for example, eligible for Head Start, they're probably also going to be eligible for CHIP or Medicaid. So Head Start will refer them to either us or to the local health office, like the Health and Human Service local office. And what we've heard from our staff is that they've been severely understaffed, like where they can't answer questions, or if they're answering questions for people, they're not reviewing that backlog of applications for eligibility. So it's like they either answer questions for folks or they risk not being able to make a dent in the eligibility application renewals.
I also had a question. This is Adam Eckelman with the Modesto Bee in Central California. I was just wondering to what extent the redetermination process will be affecting other states and recommendations for where reporters outside of Texas might look to cover that story better.
I can just say, I mean, Texas is definitely going to be worse than a lot of other places. But this is a huge issue everywhere. I can, if you want, I'll share my email at the end and see because I can probably connect you to folks who know the landscape in California better. But the reality is that agencies are essentially responsible for reaching out to millions of families, many of whom might not have their contact information up to date, or might have language barriers, or might not be have like fully understand how to even go through the process. So it's a huge issue everywhere. But I do know that other states have better policies for giving families more time to complete the process, or making their materials available in more languages, and there are many other things that agencies can do to make this process easier for families, versus like penalizing families and taking them off as soon as they complete the bare minimum steps to try to reach families. But those are some examples of the metrics that we're looking for in terms of whether state agencies are doing what they can to make this process smooth.
And I'm really glad that y'all will be writing about that, because it is a question of where state leaders think it's important to invest resources. And like in Texas, our state leaders have decided not to invest resources. And so that's why Texas is lagging below other states. But anyway, if you have any other questions, please, we'll have our email, so you can also contact us directly.
Yeah. Actually, I'll just say one more thing. Yeah. This stat that's currently on this slide, it's a national estimate. Experts are fully expecting 3 in 4 children who are still eligible to lose their Medicaid. And that's across all of the states.
So back to the issue of, so I wanted to highlight some of the systemic issues, right? And we've talked about the agency staffing shortages. And so this has been a gap where nonprofits have had to fill in. And specifically for us, for CDF Texas, our staff on the ground have, because of the close relationships that they have with the local agency, they have offered to help them by answering basic questions for families of how do I fill out my Texas benefits application. For those who don't know, my Texas benefits is the application for CHIP, Medicaid, for SNAP, for which basically is like nutrition, EBT. So if families have questions about that and they're trying to fill it out online and they don't know who to go to, they might go to their local agency, like I was mentioning earlier, and they might not have the staff to take the time to answer all of their questions. And so that's where our team has offered to help and has been able to amplify some of the staffing capacity for the agency. And so, as I mentioned earlier, in October, we were hearing that they were still processing applications for May. This is an area of government that has failed its community, because if you're having to have nonprofits fill in, like have to step into this government function of just answering basic information, that is a systemic challenge. So that's something that our organization and together with other partners on the ground have been trying to do, just to help get families the coverage that they need and ensure that they have the benefits that they're eligible for. It's just they're waiting on the state. Next slide, please, Cindy. Even before the pandemic, as I alluded to earlier, that the process to apply for benefits was already very onerous for families and confusing. And I would encourage y'all to check with your states, because every state might have a different process. In Texas, families are asked for verification of income, so they have to submit pay stubs. And prior to the pandemic, what we had seen was that the agency was asking families for pay stubs month to month. Families thought that they had already submitted the pay stub and that they didn't need to submit an additional form that verified income. And so where they thought that they had completed the application, they actually had not. And they were showing up to the doctor's office with a sick child and finding out at the doctor's office, actually, you're not enrolled in CHIP and Medicaid because you didn't complete that final step in the process. And so that was really difficult for families, and it really highlighted the incredible work that our health and outreach teams do, because they're on the phone with families at 8 p.m., at 10 p.m., walking them through the process and ensuring that they submit everything, that they have records, copies of everything, because they know where the multiple steps in the process and where families can get caught up and think that they have submitted information and then not actually have completed the application, not have coverage. And the child ends up being the one to miss a doctor's appointment, or where the parent has to figure out how to pay out of pocket, which are definitely stories that we have from on the ground. Next slide, Cindy, please.
Yeah. And I just wanted to cover again, like how media can play a crucial role. Really, we need all hands on deck just to get the key messages out to families. At this stage, where we really want every family with Medicaid to know that they need to update their contact information with their state agency. So updating their phone number, updating their address, if there's an app or an account that they can access to get updates on their status for Medicaid and SNAP, making sure that they have access and can get into their accounts with no problem. Here are some examples of coverage that we've been able to get. One of the biggest challenges with this issue, for us at least, is and also it's not Texas specific, but one of the big challenges is both like emphasizing like how bad this is going to be, while also empowering families to realize they have agency to at least stay on top of their own case. Some of the headlines can verge on doom and gloom, everything is terrible and Medicaid is failing, which is also rhetoric that many of our lawmakers like to cite when trying to strip money away from that program. But when working on this issue, we're really trying to get reporters to have clear information about the process and timeline, recognizing that March 31st, 2023 is a date where we would like all families to update that contact information, make sure that they can get into their accounts, but also knowing that the redetermination process will take months after that date as well. And so making sure families know to continually keep an eye out in the mail for their renewal notice when it's their time to complete the process. Having some information on how this will affect different groups will also be super helpful. We do know that many state agencies across the country are going to first focus on the groups they're expecting to no longer be eligible. So those are the moms who were pregnant during the pandemic but no longer pregnant. Those are going to be the children who turned 19 at some point in the past couple of years and are now no longer eligible for Children's Medicaid. And then those are going to be the families whose income has increased over the past few years as well. What we try to do is include, whenever we're working with a reporter on this issue, we include a couple bullet points on the key takeaways and information that people need to know. We really appreciated this reporter in these. It's kind of small, but in the example on the screen and the takeaways blurb, there was like one bullet that was speaking directly to the action that families need to take. And yeah, just every opportunity we can get to get this message in front of families will be super, super helpful. And that's going to bring us to our final topic, which is covering the whole family. And I think I'm passing it to Michelle again. Actually, no, I'm covering this one. Okay, so when we thought we were all going to be in Zoom together, we were going to have y'all answer this question in the chat, but instead, I will answer it. Of course, there are many Texans in Texas who go to low-cost clinics to access healthcare. For communities that are on or near the border, they will often travel to Mexico to get affordable health care. Of course, there are many families who don't have that option if they aren't lawfully present. But the key reason I wanted to ask this question and pose this question is because low-income Texans who are immigrants and are lawfully present can actually get health care through healthcare.gov. Traditionally, your household income needs to be above the federal poverty level to access any kind of plans and be eligible for subsidies to get affordable plans through healthcare.gov. But if you are an immigrant and lawfully present, then even if your income doesn't hit that level, you can still access those subsidies and those plans. And the reason that I bring this up is because that's actually not the case for U.S. citizens. So this is a situation where there's obviously an issue of equity, but also confusion for families and especially mixed status families. This infographic illustrates what the Medicaid coverage gap is. At this point, 39 states have expanded Medicaid or are in the process of expanding Medicaid. But this is one of the key issues that we work with because it's a really key policy solution that we need to get a lot of our uninsured population connected to healthcare and then help our healthcare system as a whole better be able to provide care to everyone. So as you can see, most people have to make their income needs to be above the federal poverty level to access healthcare.gov. For low-income folks, people can get Medicaid, but in states like Texas and in the remaining states that have not expanded Medicaid, agencies and governors have made the income limits and eligibility requirements extremely restrictive to the point where we just have millions of uninsured folks who have zero health insurance options at all. This chart notes that the average income limit for parents to access Medicaid is 41% of the federal poverty level, but Texas actually has the lowest and stingiest requirement at 17%. That translates to an income limit of about $230 per month for a mom of two. And so we're really seeing families who are giving up their own ability to get Medicaid so that they can get all the other resources that their families need. Also in Texas, childless adults can't access Medicaid at all. And while Texans with disabilities can get insurance, Texas, like many other states, has very narrow criteria for what qualifies. And many people have to make several trips to the doctor to get the medical documents they need to apply for SSI and disability. I'm gonna open it up to a poll, which is what percentage of Americans in the coverage gap do y'all think are people of color? So raise your hand if you think it's A, 51%. Raise your hand for B, 58%. Raise your hand for C, 70%.
Okay, that's a lot more folks.
That's a lot,
I think
yeah.
70.
And then raise your hand for D, 74%. Okay. The answer is 58% for across all of the remaining non-expansion states. 70% is the percentage of Texans in the coverage gap who are Black or Latino, and 74% is the percentage of all Texans of color as a share of the coverage gap in our state. And the reason this is such a huge race equity issue is because the remaining states that have not expanded Medicaid are mostly in the South, and that legacies of slavery and the ways that governors think and legislators think about the welfare system and safety net have impacted political conversations around Medicaid and Medicaid expansion. I'm going to pass it to Michelle to talk about how, even if expanding Medicaid would not directly benefit immigrant families, how it would improve the healthcare network as a whole for all of our communities.
Yeah, so we would have, we know from reports and from data that from states who have expanded coverage with similar state political leadership as Texas, that it does result in better health outcomes. There's less medical debt. There's fewer rural hospital closures, and there's another slide about that. But the benefit, and next slide too, please, Cindy. There's also an economic argument to be made, and we've tried all of these, by the way, here in the state. We've had chambers of commerce sign letters to the governor highlighting what a positive impact it would be on the state, how it could draw down federal dollars to help rural areas, and then of course there's the how it could improve maternal health outcomes, which Texas has definitely also been on the forefront of just lacking in improving maternal health mortality and outcomes for pregnant moms. And so we've had the opportunity to engage with state leaders on all of these different messages. And so what we quickly realized across the almost 10 years of working to try to get our state to expand Medicaid and expand healthcare coverage is that our state leaders, that facts and data only have so much power, if at all, to persuade. that it comes down to political communities being able to affect political power at the ballot box. And so that's where the next slide comes in. And Cindy, I'll hand it off to you, where we very much decided to also engage in a grassroots strategy for our communities.
Yeah, I think there's a question in the room.
Yeah, you know, you mentioned rural communities. Could you at some point speak to the challenges in this effort to re-enroll, you know, in this looming deadline, what rural communities kind of have to overcome in terms of, you know, getting that at Medicaid re-enrollment?
Yeah, I
Yes.
think this is going back to PAG. Michelle, do you want to take that?
Is it going back to PHE, or is it about just, I want to understand your question. Sorry. I understood it just the impact
Like,
of.
I wonder if particularly, like, are there obstacles for rural communities to get the information that maybe folks in urban communities may not? So
Yes.
the folks I cover are Latinos in like rural areas, and so I wonder what other challenges have you found that maybe folks in rural communities face in terms of, you know, getting information, access, you know, finding ways to re-enroll. You know, are there more language barriers that they find? Like, I'm just curious if there's, you know,
Yes.
yeah.
Yes. No, thank you so much for clarifying your question. And that's helpful because we and this is obviously just for Texas, but last Texas legislative session, we partnered with a part of our digital organizing and found that there were very clear information deserts in our rural areas where information, this was related to Medicaid expansion, but where information about Medicaid expansion and how it could benefit rural areas that I'll talk about in like 2 more slides, rural areas in Texas were catastrophically affected by clinic closures. And yet rural areas voted for leaders who have chosen time and time and again not to expand Medicaid. Why is that? It's because the information is not getting down to the communities. A lot of our like local newspapers or have shuttered. I mean, I know y'all know that. And so a lot of these rural communities are relying on other friends sharing information on Facebook that may or may not be, or oftentimes are not articles that are based on fact. They're just political ideology or something they found from another outlet posing as news that isn't. And so what I'm trying to say is that there are information deserts also, particularly for Latino communities. I mean, we try to ensure that the information that we have there's always a Spanish version. And we're also working to try to, because we have a growing Asian American population as well. And so we're trying to get other language accessibility as well for the information that we put out for families. But that plays a really critical role in how rural areas are and are not represented when it comes time to invest or disinvest in places. And I'm sorry, I'm kind of being kind of broad and vague because I'm trying to think of how it could relate to Illinois. But that definitely has factored into the work that we're doing as a nonprofit organization in really focusing and honing in on our community grassroots strategy, because that's the best way to get the word out directly from us.
Yeah. And that, I know we only have a few minutes left, so I'll try to run through this quickly. This brings us to, we realized that to overcome political obstinance around Medicaid expansion, the solution was to build people power. So we created a grassroots campaign that is designed to bring constituents directly to decision makers. We have a storytelling infrastructure. We have programming all year round to engage people in this issue and on healthcare, and keep up the momentum for this issue at the Capitol. One of a quick example of the kinds of stories that we and people and advocates we work with is Trish, who worked as a CNA, had varying income from month to month, and fell into the Medicaid coverage gap. She got an infection at one point that led to a hospitalization where she learned that she had a blood disorder, and also at the same time got $2,000 into medical debt, which it was an amount that she could not get herself out of. And she also, one of the most powerful parts of her story is that she's a single mom, and she is the sole caregiver for her son who has a disability, and she is the one person that he has to take care of him. And one of the things that we saw a lot across our state is that many of the people who are affected by the coverage gap are moms who can't work full time because they need to care for someone at home. And so because of that, they're not able to get employer sponsored insurance. They are oftentimes, experiencing injuries or stresses to their own bodies while caring for another person. And we work really hard to try to elevate stories like Trish's to our state news outlets. I'm going to pass it to Michelle to speak a little bit more on the rural piece.
Yeah, so on our rural strategy, as I mentioned earlier, we very much realized that we needed to have a stronger grassroots organizing campaign, and that we needed to target and focus on rural Texas because that is where the political power lies. And so one of the things that we're doing is trying to connect. So the families and communities where we already are, like I mentioned earlier, we have an office in Tyler, Texas. Families there already know that they can trust us. They can come to us and they've come to us for multitude of basic needs that they need support with. Now what we're doing is trying to connect that the gap in their basic needs to the systemic issues, and then to the political power, to building, to really drawing a through line between their lived experiences and the state leaders with the power and the capacity to make changes and why they haven't. And so if you click, so this was there was a tweet from a governor right next door, Louisiana, that touted how he had expanded Medicaid, unlike other neighboring states, and they hadn't experienced a single rural hospital closure. And so that for us just very much in a very succinct way highlights the importance of rural Texas to changing the face of how benefits are funded or not in our state.
These are just some of our partners. The three at the top are our key partners that have joined us in our healthcare campaign and spearhead it with us. And then the five at the bottom are community organizations in different areas across Texas. So East Texas, Panhandle, Tarrant County, which is where Fort Worth is, Project Vita in El Paso, and then Lupe in RGV. So we wanted to highlight these. We do have many more partners who work with us on this work, but we wanted to highlight that we have invested in these particular community organizations because we know that one of the ways to start reaching people with information about these broader systemic issues and connecting them to information to take action is by going through an organization they know and trust in their community.
Question. I just, when you said the hospitals and rural communities closing, is that, are you tying that to the fact that because there's not a Medicaid expansion, so that's not like, that's like specifically tied to that and not just general investment in hospitals, but specifically because there's such low number of people insured, like the hospitals are just, like all their charity care, basically, it's being run by just charity care and they just run out. They just can't pay. Is that the connection? Just
Yeah. Yeah, so there's definitely Medicaid expansion would draw down additional federal dollars that would have helped keep some of those hospitals open. And that would definitely have helped those rural communities ensure that they had more access to care. So there is definitely a line, but it's related to Medicaid expansion here in our state.
I have to say, I think the Sick of It Texas hashtag is brilliant. I think listing things like we're tired of rural hospitals closing. I don't know how many of you have asked for a show of hands. You may live in a city, but you have relatives who live in rural areas. And I do. And in fact, my little small hometown of Cairo, Illinois has no hospital. So I think trying to develop a movement around these key issues. We're tired of kids with no health insurance. We're tired of people dying for preventable illnesses. We're brilliant. And I hope all of you will maybe look into finding ways to think about that in your areas. But I want to take this time to thank you both, Cindy G. and Michelle Castillo, for talking with us about this very important issue of healthcare access for the people who need it most. We're so grateful to you, and I'm sure the journalists will be reaching out to both of you in the coming months. So thank you for joining us.
Thank y'all.
Thank you so much for having us.
Take care.